My name is George Verghese. I'm one of the orthopedic surgeons. I work here at the Trust at Chase Farm Hospital. I'm also one of the staff governors. So this event, the Medicine for Members event, is one of a whole series of events that we hold as a trust, where we take a topic of interest to the members meaning yourselves, and these topics are picked by yourselves, and we have a series of talks on that topic. Hopefully you will all like these. For this occasion, we have picked the new build where we are right now, our new home. For this evening, we have some very important people who have given up some of their time to come and speak to us. We have the chief executive who's going to tell us about how we transformed from a concept to reality. We have the senior matron who is going to talk about take you on a journey through this building, a virtual journey, if you will. We have the medical director who's going to tell us about the innovative things that we have in this building, both in terms of structure as well as working practices. And we have a senior nurse practitioner who's going to tell us about how a typical patient's journey goes through this trust. We will all have an opportunity to ask questions later. Just stick your hands up, the microphone will come to you, and please introduce yourself before I ask the question. There'll be other governors as well here in this audience, and we can meet them later and ask any further questions, targeted questions. Right, so that's me, and we all know this building in its current shape and form. And how many of you have known it like this? Oh, fantastic. Okay. So the history of this place goes back almost to the 1730s, when this started off as a workhouse. Not exactly here. It was in Edmonton, and eventually it moved here. And this piece of land has seen action as a workhouse, a school, an infirmary, and now as part of the modern day NHS. So I'm going to invite Natalie Forrest, our chief executive, who's going to take us through the more recent history of this place. Natalie.
Okay, so let me tell you a little bit about what we've been doing here on the site in the last, it's probably about 4 years of story. So we're going from the dark ages to real time in a very short space of a presentation, but I think it's important that we focus on the here and now. It'd be lovely just to talk about the history, but I'm going to flick us on very quickly. It's quite a big change from what was on this site to what we have now. A little bit of context about why we've done all the work that we have and the money that we've been spending here at Chase Farm. So those of you who know the site will know that not a lot of money had been spent here for a long time, and despite the fact that we were delivering NHS services, the buildings were becoming more and more difficult to provide good quality care and patient experience. And so there was a real need for something to happen. The BH strategy that redefined where clinical services should be provided across this part of London, including North Middlesex and Barnet, gave a very clear steer to the Royal Free when they acquired Barnet and Chase Farm about what services actually needed to be delivered here. So it was July 2014 when Barnet and Chase Farm became part of the Royal Free London, and really from that moment on the work started to put a business case together to find the funds to rebuild Chase Farm Hospital. The Royal Free committed that it would be done within 5 years, because they were very aware that lots of promises had been made to the community of Enfield about rebuilding Chase Farm Hospital many times, and they didn't want to be part of that ongoing story. They really wanted to do something. And so that was the commitment that was made back then. And we actually started to build on this site in April 2015. So the time between the acquisition and building starting was putting the business case together, persuading the Treasury and the Department of Health that there really was a very strong case for a new hospital at on the Chase Farm site. So what were our objectives? Well, we really needed to be able to provide a sustained service here, and where we could focus on patient care and good quality and not how many buckets we had available each time it rained. We also needed to be able to develop the site to continue to deliver an affordable service that the commissioners and the NHS were confident we could continue to provide for many years, not just a quick fix. We wanted to be able to design a building that allowed us to become more productive and not waste money, and to be able to provide services that ought to be running alongside each other, where we could share opportunities and be more efficient generally. And we wanted to build something that would allow us to make the building itself future-proof as well, so that we could easily change its function in certain areas if we needed to, and also to build onto it. So the building itself was built in a way that would allow us to make it bigger if we needed to. So just a few reminders for those of you who don't remember what it was like. And we were working and providing care to our patients in these buildings when we took these photographs. So the scope of the programme just shows you a site map here to just remind everyone, first of all, how big the site was at Chase Farm, and what we actually have on the site now. So we've got the new hospital here, and we have kept the Highlands Wing, for those of you who know Highlands Wing. So that is connected by a bridge to the new hospital so that we can get across there very easily. We've got an energy centre which is providing the heat and power for the hospital, and will provide heat and power for some of the rest of the site. And we have where it says disposal, that's the land that we have sold. So obviously, how did we get the money to pay for a brand new hospital in a current NHS climate? Well, we got the money from 3 places. We were allowed by the Department of Health to sell the land and keep the money to use it to spend specifically on the new hospital. That is not something that is normally allowed in the NHS, because the land does not belong to the individual hospitals. It's a collective. It belongs to the NHS. And so we were given permission to sell the land and to keep the money to spend it on the hospital. We were also given £80 million by the Treasury in recognition of the work that was done to demonstrate how much we needed a new hospital on the site. And again, in this current climate, that is actually very difficult. So we worked extremely hard with the Department of Health and the Treasury to be recognised as a site that really needed some investment. So we had the money from the sale of the land, and we had the money from the Treasury. That still wasn't enough. The whole site, including some of the things that you can't see yet, the roads, etc., will come to about £200 million. So we've had to borrow some money as well. So the NHS will allow borrowing for good reason, so we have borrowed some money. And of course that borrowing has meant that we have been careful how we've spent our money, because we have to pay it back. that's how borrowing works. So we've had to really think carefully about where we've spent our money. There are no, we haven't been able to do luxury things that perhaps, we would like to. We've been very careful to make good decisions about how we've spent the money at the hospital. And I hope that those of you who come and have care here will see that we've spent the money in the right places, and that's in our clinical areas. As you will probably know by now, a lot of the site, well, some of the houses are already being lived in. That's how quickly they've gone up. But we're also going to be having 2 schools on the site. So a primary school and a secondary school, because obviously it's a big piece of land, and that's been bought by the SFA, who are responsible for providing school provision in areas of the country where there aren't enough school places. So I mentioned that we can expand the size of the hospital, because some of you might be thinking, well, why didn't they build this and why didn't they build that? Well, there were 2 reasons. One, probably 3 reasons actually. The first reason was what we built was a hospital that was big enough to re-provide the services that we were already providing in the ramshackled old buildings, because that's what we were asked to do. So we have built a hospital big enough for everything that we were already doing at Chase Farm. The second thing was that we didn't have any more money to build a bigger hospital. So the reality was, you could say, well, why didn't you build some extra floors and some extra theatres for when you need them? Well, we simply couldn't afford to do that. That would have been a fabulous idea. And also because right now we don't know exactly what is needed. We need to make sure that we're collaborating with our partner organisations across North London. Those of you who know that our commissioners and the STP are all looking at what should be provided here at Chase Farm. So when those decisions have been made, that hopefully will include public engagement, and people will have an opportunity to give their views if they haven't already, because some work has already been going on around orthopaedics, for example. Then we will know what's needed. But we have planning permission to be bigger than we are, and we have built the hospital to allow us to, now this is all technical, to bolt on more bits to the hospital. So it's obviously much more complicated than that, but if you look at the building from the outside, you'll see there's quite a lot of flat roof that isn't the whole height of the hospital, and we can build on there. We already have put in all of the services and the infrastructure to be able to do that quickly if we needed to. So I think these are just a few graphics that will show you where we could potentially expand. So that's what we look like now. The turquoise is where the surface grade car parks are now, but the groundworks have been done to allow us to build on top of there should we get to a position where we need a multi-storey car park next door. And then the purple is where we could potentially expand both the building that you're in and areas within the site that we can build on, that we have planning permission for. So the new hospital, the hospital that you're in at the moment, so it has 4 floors and a lower ground floor. So the 4th floor is just plant. I went up there once, it was really interesting, and I don't intend to go there again unless I have to. But all of the other floors house patient clinical areas. So there is not a lot of non-clinical space within the hospital. In fact, the main space that's non-clinical is the one that you're in now, which is where we have put all of our meeting rooms and our hot desk space, so that by putting everything together we can make the most of it and we need less. That's the logic. So on the 3rd floor, with the best views in the hospital, are surgical beds. So we've got 42 single rooms, and 2 4-bedded bays. All the single rooms have ensuite bathrooms and beautiful views. Not that I'm recommending that you come and stay, but if you do have to, they are, they really are probably the best hospital room you could find in the NHS. On our second floor, we've got our operating theatres. We have 8 operating theatres, and all of our patients, whether they're coming for day surgery or to have an inpatient stay, go straight into that floor. All of the admission areas are there, and our recovery space is there too. On the first floor, we have what we call our specialist outpatients. So those are the outpatient areas where the clinicians need a certain type of equipment or a certain configuration of a room, whereby they couldn't go into a room that's shared with other people. So I'll give you an example. If you went for an audiology appointment, you'd expect to have soundproof booths so that you could have your hearing tests. If you were going for an ophthalmology appointment, you would expect that they'd be able to do your eye tests for you. If you were going for a dental appointment, you'd expect a dentist chair and not a trolley. Those sorts of things. But by and large, the rooms are exactly the same wherever you go for a clinic appointment. The rooms look the same. And down on the ground floor are all of our other outpatient departments, where you go for a blood test, where our X-ray and CT and imaging are our urgent care centre. And then down on the lower ground floor, although I always feel guilty that they're down on the lower ground floor, they have lovely view of the gardens outside, and in fact they were there, we've put them down there on purpose because we think that that's possibly the first place that we will need to extend the building, and so by putting them on the actual ground floor means that that's an easy extension. So design innovation. I'm only going to talk to you a little bit about innovation because Dr. McLennan, when he comes up here, is going to talk to you about the patient pathway, and it will make a lot more sense. But some of the things that we've done around the design of the building first are in endoscopy. For those of you who don't know what that is, it's when we put a camera into your either into your mouth or up your bottom in order to do a test, and a camera and have a look. It's not a great procedure. If you don't need to have one, don't. But if you do, come here because we have an absolutely fantastic service. And that's not just the team who provide the care. The environment is fabulous. So you would have your individual room. You've got your own bathroom. So from a privacy and dignity perspective, it's just so much better for patients. We've got, I told you a little bit about our rooms, that they're all the same, and that obviously makes things much easier. It's easy for us to schedule who's using what room, and for patients to all get the same experience, and for our staff to know where everything is. We have a barn theatre. Does anyone know what that is? Now, some of you, and this is... are old enough, please take that in the nicest possible way, to remember MASH on the TV. So this is something that is quite well used in the military, and it has been used in Europe very, very successfully. And it is a big operating theatre, and we operate on 4 patients in that operating theatre all at the same time. And what that allows us to do is to maintain safety in a completely different way, visibility, learning. I'm sure you can appreciate if something happens at one operating table, the surgeon, the anaesthetist, the nurses, they've got the support of 3 other teams around them without even having to bat an eyelid. It improves efficient working because we can each see what's going on. And it has been demonstrated to have real success rates around reducing infections and improving not just our outcomes but our staff morale, because there's a much more team supportive approach by working in the barn theatre. So there are 2 others that look like this in the country, and they're both in Lancashire. I'm from Lancashire. I don't know whether there's a connection, but now we've got the best one in London. And we have bookable rooms and hot desks for staff to use rather than old-fashioned offices that everyone, someone sits in their office and then when they're not sitting in their office, it's empty for the rest of the week and it's not good use of space, so we share. So this is what it used to look like at Chase Farm, and this is a real picture. We didn't make this up. But now we're paperless. So, well, I say paperless, paperlight. We have a little bit of paper, and that's because we're still implementing all of our processes and changing from having paper into having electronic systems for everything. So if you come as a patient now to Chase Farm Hospital and also to Barnet, we will look at your records electronically. Yes, that does mean that the doctor's got to look at the computer, but it 100% guarantees that he has all of your records in front of him every time he sees you. And it also means that he can look at your notes and your reports wherever he is in the hospital. So you might be up on the ward having had a surgery and he could be downstairs in a clinic and he can see your notes. Or your anaesthetist might want to check up on how you are post-operatively. She can just log into your records wherever she is in the building. So the level of safety and overview that gives us is above and beyond what did one nurse call that, sort of a crumbly mountain of old papers. So much, much better. And we've tried to make other things digital. So you can now check in to your outpatient appointment using our Express check-in. And in the past, even I've thought, those barcodes on those letters, they never work. But actually, they always work now. Those sort of glitches and things, technology advances so much quicker than we do. And so it's actually really easy to check into an outpatient appointment now. We're going to do lots more to make it even easier, try and get it so that those of you who use mobile phones can use your mobile phone. That doesn't mean to say we're going to take away the people, but the people are there now focused on helping those that need help, not everybody, because before everybody had to be checked in by a person, and then it meant that people who were really in need or anxious had to just stand in a queue and wait. So it's a lot more self-service orientated. The nurses up on the ward, they can now, when you press your call bell upstairs, they can talk to you straight away. So they can tell you that they're coming, they can ask you what you want. So if you're able to say, I just want a glass of water or I've got some pain, rather than traipsing all the way to your room to ask you what you want, they can actually bring it with them. But mostly it provides you with reassurance. And they can also talk to each other and they can escalate if there's an issue very, very quickly. So we feel like we've got much more visibility of what's going on. And there's lots of other things that we do that you don't need to know, but we manage all of our rotas electronically. So at any one point in time, I can know who's here, who's not here, who's on holiday, who needs holiday, who should be on holiday, those sorts of things. And this is the most exciting one for patients. We haven't quite got it exactly how we want it yet, but we're going to be launching a patient portal. Some of our patients who've been for surgery in the last few months will have used the patient portal for their preoperative assessment. But it will be a way in which you can communicate with us and we can communicate with you. So no more waiting for a letter, wondering about results. You'll be able to go onto the patient portal with your own identification and see anything that relates to you that we'd like to communicate with you. So what are the benefits? Well, the benefits for us, some of them I've already told you about, but it means that we know exactly what's going on now. I'm not looking at information about what happened last week because I can't really do very much about what happened last week, but I can do something about a whole group of patients who are queuing or waiting too long for an appointment right now in the building because now I know about it. The systems will allow us to change waiting places, to free up clinics, to change the pathway for patients so that you're not queuing or waiting for things. And it frees up our time to do the things that we need to be doing, like helping patients who need help and spending time with patients on the wards instead of wondering who's answering a call bell or coming to answer a call bell when actually what you needed was someone to go and buy you a newspaper, for example. I'm going to stop talking because I could talk about Chase Farm forever. We're going to do questions at the end. I hope you have got some questions for me, but you're going to have to hold them. And I'm going to hand over to my colleague, Dr. McGlennon, who's going to tell you a little bit more about some of the things that I've spoken about, but put them into the context of what a patient journey looks like.
Okay, should we do the same thing as before? If you can't hear me, put up your hand. Okay, if you can't hear me, put up your hand. Okay, I'm going to speak even closer. Can you hear me now? Right, so I'll carry on doing that during the talk. So if you can't hear me, put up your hand. If you can't understand me, put up both of your hands. My name's Alan McGlennon, and I am a doctor. To be more specific, I am an anaesthetic doctor, a doctor who puts you to sleep and wakes you up again, hopefully. But I'm also the medical director for Chase Farm Hospital, and my involvement has been for a little bit over 2 hours. 2 years. It does pass very quickly. Yeah, so it's been it does for 2 years, and so part of my remit is to give a medical influence to decisions that are being made, and some are to give a sort of process understanding of what is required, and sometimes it's a little bit of taking innovations that have been brought in and passing them back to the medical community, who don't embrace change as well as everybody else does, in my experience. Before I start my slides, I do like to give you 2 reflections on the words innovation and change. And these are personal reflections. Innovation sounds great until you really start thinking about where you are in the innovation journey. When you're right at the start of the innovation journey, it can be a little bit scary, and especially when it's to do with healthcare. Who would like to be the first patient that I've ever anaesthetized? You know, who would like to be the first to have an operation of its sort? Those sort of innovations are a little bit scary. When you see them and when they act well, when they turn out for the best, innovations can be almost indistinguishable from magic. You know, something that didn't happen before does happen now. It can be tremendous, but also it comes with its own risk. I much prefer a different type of innovation, which is just a little bit further along the road from the start of the innovation journey, when things work really well and people are now used to it, people understand it, and you can package it all together separately. And that you almost don't see at all. It's a bit like background music. If it's functioning well, the innovation you don't actually know is there. It just underpins the whole of the processes. That's the kind of innovation that we like. My other reflection is about change and how nobody likes change. They really don't. They say they do until they have to change, and then they don't. And patients are no different, and doctors are no different. We all know it's good for us, but we just don't like to do it too much. And so how do you approach that? Well, you can always just go for a big bang and just get it all over and done with. Or you can sequence it out. And most people actually don't go for a big bang, they do go for a sequence. And that is actually what's happening with our innovations. Some of them are there, some of them we're using to its full capacity, some of them are there and we're only using them to partial capacity. Some of them are in the background and we haven't just started just yet, mainly because we've got to make sure we do it in a sensible, timely manner. So a lot of what we talk about, we have got. There's some of what we're going to talk about that we're getting. So bear those things in mind. So we did plan this. We did plan a lot of the building and the hospital, and we did plan a lot of the digital technology that underpins it. We didn't just rush in with a big pile of the government's money and a great bit of grass to build a hospital on. We did a lot of planning beforehand, and what we're learning in this area of the group, we're going to be using in other areas of the group. There are building projects that are happening down in Hampstead, and there's an unveiling of the digital aspect of our hospital, that the lessons learned and the functionality gained will be used down in the Hampstead site, and a bit more in the Barnet site, and of course in the other areas that we inhabit, so Finchley Memorial, Edgware Community Hospital. Most of you might have walked along this corridor, and when I get a quiet moment, which isn't often, there is a bridge that's just out the end of the corridor here, and you can get a good view on the left-hand side of the picture there. And I took that in a hurry yesterday. This isn't a stage photo, although it does look like it. And I just wanted to just take a quick snap just to see people using the check-ins, because the check-ins look benign and they look familiar now to everybody. You see them in supermarkets, you see them in airports, you see them in shopping malls, but it actually belies a whole lot of innovation that is useful to the running of the hospital. And the important thing to us was that they had to be really easy to use, so much so that you took away a lot of the reception area so that it didn't feel like being in a doctor's waiting room, so it didn't feel in quite an oppressive, sterile environment, so that it could become a little bit more like a public area, a common area. Maybe it's a bit like a shopping mall, maybe it's a bit like a departure lounge of an airport. And as you can see, that's how the architecture is laid out. And mainly because this check-in area works quite well. At the moment, people are encouraged to bring along their letter with a barcode and put it into the scanner so that it knows who you are. You don't actually need to bring that along, you just have to come along with your birthday. And most people do tend to remember that. And for the 1 or 2% who find that the system doesn't work for them, there is members of staff there to give you a help. We call them our concierges, because they're not receptionists, they just have a little bit more time to help you, to chat, to sometimes direct, to sometimes just take you to where you need to go, to get the wheelchair, to give you the directions. And that is mainly because this does a checking in very nicely. It doesn't just do the checking in, it also interacts with the patient admin system. And that allows a whole lot of work behind the scenes to just make the journey a little bit nicer. If you've come along to a busy clinic that has got all the patients turned up at one time when we didn't want that to happen, but they just turned up, well, we can choose to redirect patients, redirect them to where they sit and wait, or if they did need to have something done beforehand, a blood test, an x-ray, we can divert them to do that first rather than second. So it's got an intelligence to it. It's also got intelligence because it lets the clinicians and the staff and the nurses know who's waiting. So if they do need to have more resources, they can actually call upon that earlier. It's just a little bit of intelligence which is different from the experience before. When I used to run outpatients, or when I used to sit in outpatients, there was a list and you came out and you shouted a name out And if there was hundreds of people there, you just worked through hundreds of people and there was nothing you could do. Some of you might have been upstairs with the specialty outpatients, and the only reason I show you this is just to show you kind of how different the feeling is. There were something along the lines of 16 different outpatient areas in the last hospital, everyone looking completely different. Some of them were porter cabins, some of them were the old orphanage, some of them were purpose-built buildings, one of them was converted from the swimming pool. I mean, it was extraordinarily variable, and it meant that the clinics had to run in a different way. The architecture actually did make the clinicians work differently. But now all of our areas are the same. The TV that's there, if those of you who haven't experienced it, that pops up your name when it's your time to go. It tells you which room to go to. And that's all it says. It doesn't say what specialty even that you're going to, just tells you which room to go to. And in fact, if you didn't even want your name to be shown, you can elect to not have your name publicly, or an alias or a symbol, whatever you choose. But what it does mean is that you sit there in a very, again, this was just taken randomly, that is what the waiting areas look like. Not hutched up like, you know, the old outpatients, which sometimes you went in, it looked like Ellis Island, you know, people queuing up. Whereas now, if, you know, when we bring dignitaries around and they're looking at us horrified, like, why is it not full? Why is it not busy? Well, it is busy, it just doesn't look, it's just sequenced quite nicely. So you get called into your room, and that's the great thing for the doctors, because, I mean, it seems such a strange thing to actually focus on, but in days gone by, it was somebody's job to go out of the room to call the patient. In my last place where I did outpatients, it would take me a minute to go out of my room, down the corridor, around into the waiting room, call their name, it was an obstetric clinic, and walk back with the patient. And they tended to have kids with them as well. So the walk back would be a minute. And a joking aside, this was taking 2.5 minutes for each patient. You know, you can do the maths yourself. Now, our system allows us to anticipate that. We can press a button on our screen, which puts that call out, the patient comes straight through. And when you get your timing correct, that means you finish with somebody, you're doing your notes, you've asked for the patient to come, and it's seamless. So you save time, not just for us, we don't have to employ somebody else, any more reception staff, and it's just easier for the patients, frankly. In time, our patient portal will be available for the handset so that you can actually just do it on your smartphone or your smart tablet, whatever you choose to do. So that's kind of the outpatient experience, by and large. You go, you see a doctor, and you come home, which is kind of what you wanted, but it's not really what the experience has been in the past. But we've tried to strip it down to the most meaningful conversations. You want a little bit of humanity, you know, with the concierge, with the staff, with people, but you want to see the clinician and then you want to leave quite quickly. But what you want to know is that when you've seen them, what they've done is not going to get lost in that big maze that the NHS is. So what you don't realise is, one of the innovations of that screen is it's linked to a system which it will allow the doctor there and then to see whether or not they want to see you again and get that booking started, and it will allow them to order all the things that you require, rather than giving the patient some pieces of paper to go out to then book with somebody else who will pass on a message to a secretary to book your blood test, your operation, your next outpatient. The doctor does it there and then. Yes, it saves a lot of time because it saves a lot of people and it saves a lot of money, but actually it just means it's more reliably done. So we're quite proud of the fact that we outcome 99% of the patients correctly that we see. Now, any other hospital would be doing well if they were hitting over 85%. People lose their way in hospital systems because they've seen the right clinician who wants to do the right thing and that message gets lost. Well, this makes sure that you don't lose it. Let's say that you went to see an orthopaedic surgeon such as George, and you saw him in outpatients, and he said, "Do you know what, you would benefit from an operation." So you've had your conversation, you've had some pre-assessment, which you can do there and then on the day. We can direct you straight there. And we plan over the next couple of years to make sure everybody who wants to be fully pre-assessed for an operation can do so, should they wish, on the day. We're trialling it now, we're stepping it up now. But let's cut forward to the day of surgery. And I'm going to show you what it would feel like, what you might see, and why that's important. To clinicians such as myself and George and Nick in the back there, these are kind of everyday sights for us, but they might not be for you. And people who have not got a great deal of experience of using the health system are always expecting something a little bit more. They're expecting, they have an experience that's a bit like at the end of The Wizard of Oz. They think it's going to be greater, more impressive, more steam, more green smoke, and actually it's just a set of rooms connected to some computers. And if you do it right, that's all they ever see. So if you look on the left there, that is our cubicle that you come to when you're coming into day surgery. And the reason I show it like that is you just see a chair. You sit in the chair by and large. There's a computer that can come to you, it gets wheeled around by the nurses and the doctors, and they can use the computer to record their information. The white thing that you see in front is a module which allows us to take your blood pressure and do some basic tests, your pulse and your blood oxygen levels. An important thing about that is that information goes directly into your notes. So what you don't have is somebody taking those blood pressure, heart rate, time and time again, because they can't find out where in the notes it's written or whether it was written down, and not just put on a scrap bit of paper and I'll put it into the notes later. It goes directly in. And in actual fact, as soon as it's taken, it's visible, because somebody might be looking at that record who's not at the bedside. In fact, there's a high chance that the surgeon wants to know what the blood pressure and the oxygen level is, as well as the anaesthetist, as well as the nurse, and they might all be looking at that data at the same time. So though it looks like nothing, and it looks like every module you've ever seen in the past, it's wired up intelligently so that we have to do it less times, it's more accurate, and it's more visible. And in actual fact, it's quite intelligent so that if any of the numbers are abnormal, it alerts the correct set of doctors. That is a corridor. I don't suppose you came here to be told that. It's a really long corridor, okay? In that there are 8 operating theatres. And what's hard to see is that in the space before those double doors, from where I'm sat, there are 4 operating theatres. And they're single operating theatres. For those who have ever experienced it, you go into an anaesthetic room, which is a room on its own, and there's another door, and you go into an operating room, and that's closed. And that's the same as 99.9% of operating theatres that I've ever worked in my time. One room leads to another room, then you come out, go down another corridor, you go down to recovery. And we've got them. We've got standard operating rooms. We've got pretty much the highest spec ones that I've ever been in, because we've had the time and the luxury to design the space accordingly. They're big, they're spacious, they're well stocked. They've got a window, which you think is a very strange thing to actually emphasise. Let me tell you, if you come to work in the dark and you go home in the dark and you don't see light during it, it does something for staff morale. And you don't want to be operated on a place with poor staff morale, I've noticed. So they're nice places to actually do your job in. I'll come to the corridor later on. So as I said before, I'm an anaesthetic doctor, and you might not appreciate why this is impressive. So if I said to you when you go on your flight to your next holiday that you know that there's a pilot up the front, if you thought, I bet you every 1 minute every 5 minutes. They'll spend 30 seconds looking at every single one of the dials and then writing the numbers down. You might think that was a bit strange. You might expect them not to be writing the numbers down. You may expect them to be assimilating the information, plotting the course of the flight, speaking to air traffic control, not getting out a bit of paper and writing down the height of the plane, the amount of fuel that's left. Well, let me tell you, that's what was happening in our hospital till we moved into this new one. And in fact, it's what happens in 99% of hospitals in the UK. The anaesthetist, who is looking after you, who's keeping you asleep, who's monitoring you, is not always looking at you. They're sometimes looking at the screen and then writing down to record what happens. But every time they do that, they can't be fully concentrating on you. They can't be fully planning you. So we have one of the first in the UK, and certainly the fullest anaesthetic module. What does that do? It makes it really easy to record and to administer drugs. It means that in the course of an hour operation, and that's the average amount of time, they will have 10 minutes more to themselves. Admittedly, a lot of that time will just be looking at the patient, monitoring, making sure things are okay. But actually, it allows them to free them up to always be in the moment, to always be concentrating on the patient, and always to make sure that we're being efficient, communicating well with each other. What else does it do? It means that when you've had an operation and you come back for another operation, so for instance, you've had your left hip done, it's gone tremendously well, you'd like to have your right hip done, the anaesthetist will be able to see what happened the last time. And you'd say to yourself, well, hang on a minute, in the old days, they used to have big, thick medical notes, and in that was the anaesthetic record and the operation record. And I would say, yeah, that's right. 87.5% of the time, 12.5% of the time, and this is a national figure, this is not Jay's Farm, you can't find these notes. You can't find the notes at all, or the crucial bit of information is gone. So this has a persistence, a memory, a security that you don't get when you are carting bits of paper around. Because that's the problem. I know computers fail and I know disk drives fail. However, it's moving little bits of paper around that goes wrong. This bit here you'll see in every anaesthetic room in the UK, and maybe this bit. It's that bit that allows us to be very accurate in what we give and what we prescribe and what we see and how we communicate. So I could go onto a computer in the next room and I could see all 8 operating theatres, see what they're doing in live time. I can look at it from any time since we deployed this. And that makes my job, when I'm looking at the quality of what goes on in those theatres, really easy. I can compare 50 patients all at once. I can look at them time and time and time again. Look at the results, look at what we're using, look how long, look how many drugs we're using. And then actually we can look at the data afterwards. And in the next 1 year, next 2 years, that's when we're going to be making a big difference. We'll be able to look at the data and analyse it over a long time to see where we're performing well, what it was that we're performing well, how we came to that, and then repeating that. Okay, so this is the Barn Theatre. I got these photographs of this doctor here called Dr. Prabhu Sashin, who is he's smiling and he's looking pleased with himself, and so he should, because he leads the anaesthetic department. And he did an awful lot of the work in making sure that anaesthetic module was exactly fit for purpose. And also, he was very happy in the move into the new theatres because they're beautiful. You know, he is in one of these theatres, 30 hours a week. So he likes it to be nice. And this was his first time there. So you look at that from in the crowd there and you think, I don't know what's so impressive about the Barn Theatre. Why is it what's so good about it? It just seems to be lots and lots of people working side by side. In fact, I'm thinking there could be some things I don't like about that. Why is it so good? Well, Natalie's already mentioned some of the main things. It's not really because it saves space, because look around, we've got quite a lot of space, although it does. It makes things closer together, which is actually better, because you can communicate better and you can share better. So what are some of the benefits? Well, you don't need the same amount of staff, I suppose. You can share staff, although we haven't gone around doing that. It just means that the staff have got a bit more time to improve the quality of what they do. You can share equipment, which is actually quite useful, not to have lots and lots of stuff cluttering up. It's not a money saving thing, it's just, you just don't need to have 10 of these things. In fact, you only need 3 or 4 of them. It allows you to communicate. So things go wrong in theatres. That's what makes medical dramas dramatic. It doesn't actually happen as often as it does on the TV, but it does go wrong. What do you want when something goes wrong? You want other people around. You want other people who know your business, okay? And you want them to come. And that allows you to use 3 or 4 different sets of people, and they can come like that. And that has happened in those theatres. But also it gives you a feeling of being together, a collegiate feeling. People don't shout so much, they don't get cross so much, they're a bit happier, they're a bit more interested. Are you doing something interesting? Hey, I'm doing something interesting. Do you want to help? Do you want to learn? Can you help? Those are the conversations that we're after. And then you go to recovery, and it looks the same, and it's connected to the computer, so they can see exactly what you've done, exactly what you've given, and they can communicate with me back in theatre, so if they wanted to bring something to my attention, I can see it. And the nurses use the integrated devices and can communicate with handsets to tell patients, to tell the other members of staff where the patient is in their journey. And that is before they go to the room upstairs. It's a beautiful room. I'll just want to keep it there. I've not altered that picture at all. That's what it looks like. It's clean, it's spacious, it's big, and it's flashing on and off. Are you trying to tell me that I've overrun? Is that what it is? Okay. That's all I've got to say. And I believe we've got 1 or 2 more speakers, and any questions you want about barn theatres, because I know you will have them, I will take them then.
Alan, thank you very much. That is a fantastic talk about the innovations. And like I said to you before, these innovations are not just things, they're also the way we work. Now, our senior matron, Penny Roberts, Sister Penny Roberts, she's going to talk to us, take you on a quick guided tour of the OPD and the wards. Penny, thanks.
Thank you. So, thank you very much for inviting me. I shall go on a very quick guided tour.
Penny, if you don't shout into the microphone, no one will be able to hear you.
Okay, sorry. Can you hear me now?
Yes.
So I'll take you on a guided tour of our outpatients department, which you've seen a little bit of already, and also the ward. And so this is our outpatients department, and over the past sort of 9 months, or in the last 9 months, we've moved from the old building, as you can see, which was an old paupers hospital, into the new outpatients. And this is our new home. Now, when you come in through the building, all of you have already been in, so you know that we have a big open atrium, and our concierge are here to meet and greet. Okay, and there's lots of people that can help you. Now, I know I was very nervous when I went recently to UCH Hospital, which has a very similar system, because I kept thinking, how do they know I'm here after checking in? But as you go through the building, it will tell you where to go. So as you check in, it will tell you to go to whichever waiting room, and you'll see your name come up on the screen, so you'll know that you're in the right area. There are nurses and helpers and volunteers that come round and check that you're in the right area and will say hello and keep you in touch with how long the waiting time is. The floors are colour coded, as you've probably noticed already. So the ground floor is pink, and you've got the waiting areas here as seen. And the upper floors, the specialist clinics, are in yellow, and here's the other clinics that you've already seen from the other presentations. So what is also there, which you don't have in many outpatients departments, is you have the facilities to charge your phones if you need to, and there's television as well to sort of keep you occupied whilst you're waiting. And you've obviously got the Costa, and you can actually wait at Costa and see your name come up when you and call you into your waiting areas. One of the patients recently said to me, "Oh, I don't know how I'll find the room," but it's actually really easy once you know how. So each zone is labelled. So you've got E zone here, and if you're called by screen, it will call you through to a room, and above each room is, as you can see, the room numbers. Okay, and this is a typical clinical room, so they're quite nice and spacious in there. Now, we were talking about numbers of attendants, so you can see that actually per month we're getting between 12,500 to 20,000 attenders in our outpatients departments. But also you are able to, so this is just a quick slide showing how many of you are actually checking in through the kiosk and also the PAS systems. So that's the reception desks. And our outpatients compliance, which Natalie and Alan have already talked about. Now, I thought I'd also talk to you about our surgical ward and give you a tour of that. How many of you have been to our surgical wards? Have any patients? Are there any patients here? Brilliant. This is our reception area on the ward when you first come in, and there's a little seating area for visitors. But actually, for patients, this is a typical side room, so they're very spacious side rooms. And as we have already said, they all have their own ensuite bathrooms, so shower, toilets, and wonderful views. These are the views from the windows in the patient rooms. So as you can see, it depends which side of the building you're on, and I've taken them all the way round. And I thought I'd preempt some of your questions, and a lot of people say to me, why single rooms? So if you look at the evidence, it says that single rooms improve privacy and your feeling of security. Patients are generally happier in single rooms, although some older patients do feel a bit isolated, and so we do try to make sure that we pop in frequently, and we're encouraging a sort of coffee morning or a coffee session with patients in our day room as well, so that they don't feel so isolated. Patients in single rooms are less likely to be bothered with noise. I'm sure most of you have been in main hospital wards in other hospitals. They're very noisy places, however quiet we try to be. Most important for me is the outcomes are better. So we get a reduction in infection rates, and we get a reduction in medical errors. The nurses go into the rooms, they dispense the medications, they're not going to be interrupted every 5 minutes. So that does improve the risks of medical errors that you might get in other hospitals. There is a slight increase in falls, which we have been monitoring, but actually significantly, if you look over a sort of 2-year period, there is no difference. But if you look nationally in the use of single rooms, there would be an increase in falls. So we are monitoring all those little bits and pieces to make sure that we're improving our patients' outcomes. We have 2 day rooms, as I've said. We're hoping that we're going to have little coffee mornings and things like that in there for patients who'd like to sort of sit out and meet other patients. We also have a gym, and we have a fantastic nursing team. I have to say that. We also have wonderful pharmacists, physios, and medical teams. And a little bit of background as to why we are an elective surgical site. I'm sure that some of you know about the NHS 5-year forward plan, where there was a decision taken to try and reduce the pressures on the local district general hospitals and acute hospitals. And part of that is to have an elective surgical site so that you don't get so many patients cancelled on the day. And it provides more space for emergency admissions into, say, Barnet and the Royal Free Hospital. So not only do you get really good outcomes because all we do is our elective surgical work, but also the patients get better outcomes in the other hospitals as well, because they're more focused on the emergency and acute work. Thank you very much for listening.
Thanks, Penny. Yes, those views from the windows are truly to die for. Now, if
Not literally, please.
if any of you were to come in for a hip or a knee replacement, chances are that you're going to pass through the hands of Ursula, one of our nursing colleagues here, who's going to take us through the patient's journey here when you come in for elective surgery.
Okay, so I was asked to present to you the patient's voice, the patient's experience of coming through Chase Farm Hospital. Now, obviously, I'm not a patient, so we have invited a patient along to come and talk to you about their experience. But before he comes to speak, this is just a few of the comments that we got from patients during a period of 1 week from the 9th to the 15th of March, and you can see some of the things that the patients have said about their experience of Chase Farm Hospital in the new building. So, so the staff were brilliant, staff were caring, it was a good experience. Staff were very positive, a very positive air on the ward where you could pick it up. When you have an op, you need that. So now I'm going to introduce to you Robin Elliott. Robin, where are you in the room? Hi. So Robin's going to come and talk to you about his experience being a patient in the new building at Chase Farm.
It is with some trepidation and mixed feelings that I'm speaking this evening. My name is Robin, I'm 69 years old and I'm an alcoholic and have been, sorry, that's Fridays. Sorry, I'll start again. Right, I'm delighted to have been invited to speak to you this evening. My name is Robin, I'm 69 years old. I had a total left hip replacement in Chase Farm in the old unit a couple of years ago. Very positive results. I'm really pleased with it. Unfortunately, my right leg appeared slightly shorter, which made me walk slightly oddly, and I got a bit of a backache. The backache prevented me from following some of my preferred activities and normal activities. So when I heard that Dr. Ferris or Mr. Ferris was able to do my right hip, I was very pleased. I came in early Tuesday, 2nd of April. The op was done at about 11:30 in the morning, and I was fine in the afternoon. And the next day they gave me a Zimmer frame, and then they gave me a pair of sticks, and I got bored and they let me go home the next evening at about 5 o'clock. 2 days of slight discomfort at home because the morphine had worn off and the painkillers weren't quite as good, but overall really, really good. Right, they gave me an agenda of items, topics they'd like me to cover. I didn't bring any glasses with me, so that's really unhelpful. How you felt when you were coming to Chase Farm Hospital? Well, I was very happy because I'd been here before I didn't realise at the time it's going to be the new unit, but last time I was here it was the old unit. I was in a ward with other people with all the usual dawn chorus and snorts and other noises and what have you. Not too bad, but I like being alone. When I arrived and checked in, I was made very welcome. It was efficient, clean, everyone was welcoming, and it all went very, very well. Different stages of treatment. Well, they all sort of merge into one. It was all very, very good. I couldn't complain at anything. Years ago, in 1988, I had a large hen's egg sized lump taken out of my neck, and that was done in the Harley Street clinic. I had medical cover privately through work, and I have to say that, you know, that had always been the benchmark of good experience. Room, tea whenever you wanted, all the usual things. You match up to that perfectly. Everything here is very, very good. The room was good. The bed had a little thing that you could raise it and raise your feet, so I played with that for a while. It had a television, but I'm not a great television watcher. The loo was good. It had all the right handles and things. I was able to wash down as far as possible, and then wash up as far as possible, and then wash possible, as one does with a basin. My wife was free to come and visit me and help me get my socks on. Thankfully, things have improved. You no longer have to wear these green stockings, thankfully, and they decided I didn't need a raised loo seat at home. I was slightly worried about that, but I've managed perfectly well. I haven't fallen off it yet. The new facilities were very, very good. I can't say enough about the efficiency. How do you complain about something? Smoothness of overall process, excellent. Everyone knew what they were dealing with. No one said, "Oh, is it your left leg we're going to chop off," or anything worrying like that. I suppose the only thing that and it's nothing to do with this hospital, it's every hospital. You know, I'm a reasonably competent bloke. I can drill a hole in the wall and hang a picture. I can drill a hole in a piece of metal accurately, tap a thread into it, cut a thread on a bit of rod, screw it in, you know, make a nut to put on the end of it, hold it in place. I can do all those things, but one thing I can't do is why, oh why, do they give you these strange gowns which do up at the back with 3 things you have to try and do bows with, which you can't see and can't reach? Why can't they, if they want you to have something which does up, opens at the back, why not give you a sort of kimono that comes round and you can do it up at the front, longer strings and a bit more wrap round, and it would be fine. You know, last time I was in here, I watched a guy walking out, and yes, I mean, you know, it was the builder plus 100%. So, as I say, personally, I was really very happy. I enjoyed it. I've recovered very quickly. I got out fast. I don't like being in one place for too long. I feel if I'm somewhere for 3 days, I've been there forever. You know, I walked up to the doctor's 10 days after my op and had the little stainless steel clips taken out. Anyone who's ever seen Apocalypto will know what I mean. And, you know, I'm walking around on the level with one stick, and it's now my 4th week since the op. I can manage on a walking stick around the house. I use 2 sticks on stairs. I live in a 3-storey house with 28 steps and 28 steps without handrail, so I do use the sticks. But apart from that, everything's brilliant. So thank you very much indeed, and well done to everyone for what you've achieved. It knocks spots off anything else I've seen. So, you know, even the Harley Street Clinic didn't have all the technical innovations you've got. I'd actually make one innovation in this room. The lectern's on the wrong side. Having given a few lectures to people on various topics, and talks, if the lectern's the other side, people read across the screen, their eyes return to the left where they start. And you watch people and they read something across and they're confused. This should be there. Right, thank you, cheers.
So there's just one more patient experience to share. This is from a patient called Brian Hammond, and he was a patient with us also earlier in April. And I asked him the same questions that we asked Robin. So the first one was, how did you feel when you knew you were coming to Chase Farm Hospital? Now, Brian lives right on the other side of London, near to the Royal Free Hospital in Hampstead. So his response to me was, I thought it was ridiculous to have to travel so far when a hospital is on my doorstep. So he was quite honest about how he felt, so I appreciated his honesty. Then I said, how did you feel on arrival and check-in? He said, I liked going into a separate private little room to be assessed and checked in, particularly liked the reclining bed chairs, as he called them, to wait in, and found them very comfortable. The third question, how did you feel during the different stages of your treatment? Brian said he felt relaxed, the nurses were great and happy to have a joke, available to talk to, and nothing was too much trouble. I asked him about the facilities. He said the food was great, the room was great, the bed was great. He loved the TV because he got all channels, not just the basic ones, all the Freeview stuff. And he said basically he just didn't want to leave. And that is something that we hear quite often. And then I asked him how he found the smoothness of the overall process. And he said everything felt planned and organised. The consultation was good. He felt everything was great. He had a blood test earlier than he was expecting to have. And then the last thing he said, Brian was keen to tell me that if he was able to choose which hospital to have his treatment in the future, he'd happily travel across London to come to Chase Farm again. So that was great, completely unprompted.